Hello everyone, welcome to Biotech Regime. In this video, we will understand the globally spreading black fungal infection. This infection is scientifically known as mucormycosis. Before going into the depths of this infection, I would like to cite a few days back incident. It was a Saturday morning when Dr. Nair, a Mumbai-based eye surgeon, was operating on a 25-year-old woman who had recovered from COVID-19. He had inserted a tube in her nose and was removing tissues infected with mucormycosis, which is a rare but dangerous fungal infection. This aggressive infection affects the nose, eye, and sometimes even the brain. Dr. Nair carried out a 3-hour procedure and finally had to remove the patient's eye. This is how this disease works.
Many of us were seeing this in the amount that we are seeing it for the first time. The disease starts in the nose and then into the spaces around the eyes called the sinuses. And if left untreated, it progresses and gets into the eyes and the structures around it. And very often patients come in with blindness where the vision is completely lost. They have no movement of the eye. They're unable to open their eyes. And they also develop black necrotic patches, which is basically patches of skin that are dying on the eyelids, and hence the name black fungus. And sadly, there have been cases where patients have had both their eyes involved, which essentially leaves them blind.
So what exactly is this mucormycosis? It is a serious but rare fungal infection caused by a group of molds called mucormycetes. These molds live throughout the environment, commonly found in soil, plants, manure, and decaying fruits and vegetables. It mainly affects people who have health problems or take medicines that lower the body's ability to fight germs and sickness. It most commonly affects the sinuses or the lungs after inhaling these spores from the air. It can also occur on the skin after a cut, burn, or another type of skin injury. This fungal disease can be of various types, like the rhinocerebral mucormycosis, which is an infection of the brain. This form of mucormycosis is most common in people with uncontrolled diabetes and in people who have had a kidney transplant. Another type of mucormycosis is pulmonary mucormycosis, which is infecting the people with cancer. Gastrointestinal mucormycosis is more common among young children. Cutaneous or skin mucormycosis occurs after the fungi enter the body through a break in the skin. Disseminated mucormycosis occurs when the infection spreads through the bloodstream to affect another part of the body. The infection most commonly affects the brain but can also affect other organs such as spleen, heart, and skin. Several different types of fungi can cause mucormycosis. These fungi are called mucormycetes and belong to the scientific order Mucorales of the class Zygomycetes, phylum Zygomycota, and the kingdom Fungi. The symptoms of this disease depends on where in the body the fungus is growing. Symptoms of rhinocerebral mucormycosis include one-sided face swelling, headache, nasal or sinus congestion, black lesions on the nasal bridge, and fever. Symptoms of pulmonary mucormycosis include fever, cough, chest pain, and shortness of breath. Cutaneous mucormycosis can look like blisters or ulcers, and the infected area may turn black. Other symptoms include pain, warmth, excessive redness, or swelling around a wound. Symptoms of gastrointestinal mucormycosis include abdominal pain, nausea, vomiting, and gastrointestinal bleeding. Disseminated mucormycosis typically occurs in people who are already sick from other medical conditions, so it can be difficult to know which symptoms are related to mucormycosis. Patients with disseminated infection in the brain can develop mental status changes or even coma. So how can we diagnose this infection? Well, the healthcare providers will consider your medical history, will study the symptoms, conduct physical examinations, and perform laboratory tests. The doctors who suspect that you have mucormycosis in your lungs or sinuses will collect a sample of fluid from your respiratory system and send it to a laboratory. They may also perform tissue biopsy, in which a small sample of your affected tissue is analyzed in a laboratory for the evidence of mucormycosis under a microscope or in a fungal culture. Imaging tests such as CT scans of your lungs, sinuses, or other parts of your body may also be performed depending on the location of the suspected infection. Let us now talk about the treatment of this infection. Although it is a serious infection, it can be treated by antifungal medicines such as amphotericin B, posaconazole, and isavuconazole. These medicines are given through a vein or by mouth. Other antifungal medicines like the fluconazole, voriconazole, and echinocandins do not work on this fungus. Often, mucormycosis requires surgery to cut away the infected tissue. Now, one question you would like to ask is, why is it affecting COVID-19 patients? Well, the rising cases of mucormycosis in COVID-19 patients are prevalent largely because of the increased use of steroids like the dexamethasone, especially among diabetics. Not everyone is predisposed to the fungal infection, but unchecked and unsupervised use of steroid therapies can often make matters worse even for non-risk patients. Steroids reduce inflammation in the lungs for COVID-19 and appear to help stop some of the damage that can happen when the body's immune system goes into the overdrive to fight the coronavirus. But they also reduce immunity and push up blood sugar levels in both diabetics and non diabetic COVID 19 patients. It's thought that this drop in the immunity could be triggering these cases of mucormycosis. Recently, an advisory is issued by ICMR, which states the conditions in COVID 19 patients which increase the risk of mucormycosis infection. These conditions are uncontrolled diabetes, weakening of immune system due to use of steroids, prolonged ICU or hospital stay, comorbidities, post-organ transplant or cancer, and voriconazole therapy. The final question: how to prevent mucormycosis? The most important step is to wear masks. Wear shoes, long trousers, long sleeve shirts, and gloves while handling soil, moss, or manure, as these are the most prevalent places of fungal spores. Maintain personal hygiene. The disease can be managed by controlling diabetes, discontinuing immunomodulating drugs, reducing steroids, and extensive surgical debridement, that is, to remove all necrotic materials according to the advisory issued by ICMR. After recovering from coronavirus, one should closely monitor and should not miss any warning signs and symptoms mentioned above, as the fungal infection is found to emerge even weeks or months after recovery. Here are some do's and don'ts that you have to remember. Do control hyperglycemia. Monitor blood sugar level continuously. Use steroids, antibiotics, antifungal medicines judiciously. And always use clean sterile water for humidifiers during oxygen therapy. Remember not to miss any warning signs and symptoms. Don't consider all cases of blocked nose as cases of simple bacterial sinusitis, especially in the cases of immunosuppression or COVID-19 patients on immunomodulators. Don't hesitate to seek aggressive help. And most importantly, don't waste time in starting the treatment. Friends, that would be all for now. Stay safe. If you like my video, do subscribe my channel and share my video as much as possible to spread this information. Thank you.